This is a short introduction into hematology and the red blood cell. So the red blood cell has this flattened frisbee-like shape. The center is bioconcave where it kind of comes into each other. But the idea of the red blood cell is that it's able to pick up oxygen and then exchange it for carbon dioxide at the cellular level and then bring it back up to the respiratory center, the respiratory apparatus, and then have this off-gassing where the exchange of carbon dioxide and oxygen occur. In some conditions, this red blood cell is inadequate or inappropriate. In this case, for anemia means that there's not enough or not that many red blood cells. The patient may be having a condition where they're bleeding out somewhere, and it's a slow bleeding that we don't necessarily identify quickly. This is called occult bleeding. This could be in the stomach, the gut, and in some cases it's due to menstruation, as it occurs once a month. This blood loss causes the red blood cells to be inadequate, and the person has less red blood cells to pick up and exchange carbon dioxide for oxygen. What their symptoms may be with lack of these red blood cells is fatigue, headache, weakness. You may also note that they may have a paler complexion than normal. Again, this is occurring over a long period of time. This may occur on an acute onset if somebody has internal bleeding, such as the obvious gastrointestinal bleed, and over the past week has been having issues and losing a lot of blood. In this case, they may actually complain of a syncopal episode. And when we get there, their body systems are all in recovery mode. So they're tachycardic, they're slightly tachypnic, their blood pressure is a little low, and their skin is pale, cool, and diaphoretic as a result of the sympathetic nervous system response. We would ask our questions, finding out that there has been possibly some blood loss, and in this case, anemia is a result. But we would consider this a GI bleed. Other cases of hematology, as far as the red blood cell goes, is sickle cell. This is a genetic trait, and it causes the red blood cell not to be round, discoid-like, and frisbee-like shaped, but it causes it to look like a crescent moon, C-shaped, if you will. This is an abnormal development of the red blood cell, and as it travels through the vascular space, the blood vessels, it can get caught up and trapped. And this can trap multiple of these cells, red blood cells, causing issues with blood flow. So they may have joint pain, chest pain, and bleeding issues. These patients should know that they have this trait. They're usually Mediterranean or African American or of African descent. One of our last conditions is called hemophilia. This again is a genetic disability. These patients are born with an abnormal red blood cell and potentially clotting mechanisms, so they tend to bleed out easily. These patients will tell you, if not, then you would find that they have different areas of healing where they bruise easily. They may have quite a few epitaxis, but they would be aware that they do have this clotting disability. For our general purposes, when we deal with all of the patients that we're trying to think about seeing on the ambulance or in the pre-hospital setting or wherever it may be, think about the other conditions, medical or their own lifestyle changes that may cause bleeding. So this is where I'm talking about a patient that is an alcoholic. This may cause a dilution and the lack of certain clotting chemicals in the clotting cascade, or it has been inhibited because the liver has been damaged. Let's also think about the patients that may have some blood clots, either from the lung that's occurred from in the lower extremity, or they may have an irregular heartbeat called atrial fibrillation. These patients may be put on blood thinners. They may be blocking a part of the clotting cascade, and this may also cause to bleeding issues. There are a lot more bleeding concerns and issues. The idea is that we just need to be aware of them